The environment for electronic medical records is a very complicated one, and there are both things that are still developing, the intersection of technologies, the intersection of health insurance reform, the intersection of changing clinical demands, makes for a very challenging software development environment. A redeveloped VistA can offer great assistance to, number one, treating Veterans Health Administration patients. Number two, supporting providers in the Veterans Health Administration in a way that they need support from their electronic medical record system. Number three, helping to advance the incorporation of standards in health systems. VistA interacts with the rest of the world and increasingly will do so. So VistA's accommodation of standards as a reference implementation is very helpful in pushing standards elsewhere. Number four, the open source approach that is recommended in this report, I think can be helpful in putting more eyes on the engineering and the orientation of electronic medical records. Number five, the opportunities for thinking through the ways in which the software can be designed from a chunking or a modularity standpoint, so that pieces can be used in different settings, and so that commercial pieces can be used in the Veterans Health Administration settings to best advantage. And that it sets, in a strategic sense, the milieu for other things to be developed on the top of those pieces. In truly an environment where commercial and open source software can exist, can coexist, can work together and build on each other. And I think that's what a lot of the committee has in mind in terms of what they would like to see as an outcome. To get there, I think there needs to be an additional focus on how to chunk up those different pieces of functionality and how to indeed implement the appropriate standards to make that work. There are expectations on the federal agencies to be in the forefront of the use of standards in the software that they develop, and both to ensure that they're compliant with those standards as they come forward, but to also encourage those who they exchange data with and work with in the private sector to also use those standards. Standards as a term is very challenging because it means so many different things to so many different people. When one talks about standards in healthcare, for many people, the first thing that comes to their mind is the consideration of what are the standards for how to provide care that are applicable in any setting. There are other standards that are technology standards that are important as in the ways that systems work with each other and the ways in which you can build software that works on top of other software. Some of these relate to how data are transported from one place to another. It all has to come together, and to do that, to get to those outcomes, to be able to really understand what works and what doesn't work, you need to understand the context in which the treatment was applied. You need to understand the specific attributes of the patients against whom those treatments were applied. And you need to be able to move those data across a technical infrastructure with technical standards that allow for all of that to happen. Finally, I think that the opportunity here is to advance the way in which software is developed and to help lead the way for other software applications in other government and non-government settings by ensuring that the software development process represents that so important pairing of the provider, the user of the software, and the programmer in a way that can develop another success on top of the success that VistA has been.